Urea Lotion Keratolytics, Topical, General is a medication that contains two types of ingredients, emollients and keratolytics. These ingredients work together to treat or prevent dry, rough, scaly, itchy skin, such as that caused by eczema, keratosis, and xerosis. Dry skin is caused by a loss of water in the upper layer of the skin. Emollients are substances that soften and moisturize the skin and decrease itching and flaking. They work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone. Keratolytics, such as lactic acid, salicylic acid, and urea, increase moisture in the skin by softening and dissolving the horny substance, keratin, holding the top layer of skin cells together. This helps the dead skin cells fall off and helps the skin retain more water. Higher strengths of urea are used to treat corns, calluses, and some nail problems, such as ingrown nails. Urea is also used to help remove dead tissue in some wounds to aid in wound healing. When using Urea Lotion Keratolytics, Topical, it is important to follow the recommended daily dosage and apply the lotion at the optimal timing as prescribed by your healthcare professional. Make sure to use this product as directed, following all the instructions on the product package or prescription label. If you're not sure about anything, it's best to ask your doctor or pharmacist. Before using, check the label to see if you need to shake the bottle well. Then, apply the lotion to the affected areas of the skin, usually 1 to 3 times per day or as directed by your doctor. Rub it in well until it's absorbed. How often you use the lotion will depend on the product and your skin condition. Remember to only apply the lotion to the skin or nails, and avoid sensitive areas such as your eyes, lips, mouth, nose, and vaginal/groin area, unless your doctor tells you otherwise. Your doctor may also provide specific directions about where not to apply the lotion, such as on the face, broken skin, or recently shaved areas. To get the most benefit from the lotion, use it regularly. It's best to apply it after bathing, showering, or shampooing while your skin is still damp. And if you have very dry skin, your doctor may advise you to soak the area before using the lotion. Keep in mind that long, hot, or frequent bathing and washing can make dry skin worse. If your condition persists or worsens, be sure to inform your doctor. When using Urea Lotion Keratolytics, Topical, you may experience some side effects such as burning, itching, stinging, redness, or irritation. If these effects worsen, it's important to consult your doctor or pharmacist. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks. In general, most people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you notice any unusual changes in your skin, such as blistering, peeling, or signs of skin infection. While serious allergic reactions to this drug are rare, it's essential to seek medical help if you notice any symptoms of a severe allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects, it's important to reach out to your doctor or pharmacist. For those in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using Urea Lotion Keratolytics, Topical, make sure to inform your doctor or pharmacist about any allergies you may have to the ingredients in the product. This medication may contain inactive ingredients that can cause allergic reactions or other issues. If you have a history of skin cuts, infections, or sores, it's important to let your doctor or pharmacist know before using this medication. It's important to note that this medication may increase your sensitivity to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when outside. Your doctor or pharmacist may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. Some products may cause staining or discoloration of clothing, so it's best to ask your doctor or pharmacist for more details. If you are pregnant, this medication should only be used when clearly needed. Be sure to discuss the risks and benefits with your doctor. It is not known if this product passes into breast milk, so it's important to consult your doctor before using this product if you are breastfeeding, especially if you are applying the product to the breast area. When using Urea Lotion Keratolytics, topical, it's important to be aware of potential drug interactions, as they may affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval to ensure your safety and well-being. Always consult with your healthcare provider before making any changes to your medication routine. If this lotion is ingested, it can be harmful, especially if someone overdoses on it. Serious symptoms such as passing out or trouble breathing should prompt a call to 911 or a poison control center immediately. For U.S. residents, the local poison control center can be reached at 1-800-222-1222, and for Canada residents, a provincial poison control center is available. It's important not to share this medication with others as it's prescribed specifically for your skin condition. To help prevent dry skin, try using lukewarm water instead of hot water when bathing, take baths or showers less frequently, like every 1 to 2 days, keep baths or showers short, and consider using a humidifier when the air is very dry. These steps can help to maintain the effectiveness of the medication and keep your skin healthy. If you forget to use the Urea lotion, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Don't use extra to make up for the missed dose. Just stick to your regular schedule. When using Urea Lotion Keratolytics, topical, general, it's important to store it at room temperature and avoid freezing it. Some products, like foams, may be flammable, so make sure to keep them away from open flames. Keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.